Your spinal discs are not bone. They are not cartilage. They are 80% water. And between the ages of 55 and 65, that water percentage drops by nearly 30%. Not because of injury, not because of genetics, because your body stops delivering the hydration signals your discs need. I'm Dr. Laura Candy. 15 years of clinical practice showed me this. Every single adult over 60 who comes into my office with degenerative disc disease on their imaging report has one thing in common: not arthritis, not bone spurs, dehydrated discs. And what the Spine Journal published in 2021 confirmed is that disc dehydration, the actual measurable desiccation of your nucleus pulposus, is a nutritional problem before it is a structural one. Tonight changes this, because your discs rebuild while you sleep. And I am going to tell you exactly what to drink before bed to give them the raw material they need. 15 years of clinical practice also showed me something else. Every patient I ever sent for a second opinion on back pain, every patient told to prepare for spinal surgery, every patient handed a lifetime of pain management as their only option, almost none of them had been told what I am about to tell you. Harvard School of Public Health published a dietary pattern analysis in 2022 showing that adults over 60 with the highest anti-inflammatory dietary scores had 41% lower rates of degenerative disc disease progression over 5 years. 41%. Not from a drug, from what they ate. And that research is still not reaching standard clinical appointments. Today, that changes. Your doctor looked at your MRI report. It said degenerative disc disease. He told you that is a normal part of aging. He offered injections. He suggested physical therapy. What he almost certainly did not tell you is that the word degenerative describes what is happening, not why it is happening. And this is exactly the gap that is costing people their mobility. Because if degenerative disc disease is a hydration problem at its root, the treatment does not begin in a clinic. It begins with what you eat before bed tonight. In this video, I am going to show you 5 specific foods that rebuild the water-trapping structure inside your spinal discs, repair the collagen fibers surrounding them, and reverse the dehydration cycle compressing your spine. The 5th food works specifically during deep sleep. If you are not taking it before bed, you are missing the only window your discs have to repair themselves each night. The first food is bone broth. Think of it this way. Inside each of your spinal discs is a gel core called the nucleus pulposus. That gel is made almost entirely of molecules called proteoglycans. Their job is to trap and hold water. In healthy young discs, these molecules are dense and abundant. By age 65, their density has dropped by 30%. 30% fewer water-trapping molecules. That is not aging. That is a depletion problem with a nutritional solution. Bone broth contains the building blocks your body uses to rebuild that proteoglycan structure. It provides hyaluronic acid precursors and chondroitin sulfate. These are the exact components your disc gel is assembled from. Think of it this way. Your disc is a water balloon, but it is not a simple rubber balloon. It is a polymer mesh balloon where the mesh itself holds the water inside. Without the mesh, water cannot be retained even when it is delivered. Bone broth is what rebuilds the mesh. Clinical studies showed that collagen peptide supplementation produced measurable disc height improvement on follow-up MRI in adults over 55, published in the European Spine Journal in 2016. If you are over 60, pay attention to this. Disc height is not just a number on a radiology report. It is the direct measure of how much water-retaining mesh remains in your nucleus pulposus. Every millimeter recovered is a millimeter of compression removed from your nerve roots. Drink bone broth at dinner, 3 to 4 times per week. The evening timing is not incidental. Your disc diffusion window opens during sleep, and building blocks need to be circulating before that window opens. And I want to add one detail that most people overlook. Homemade bone broth provides higher glycosaminoglycan concentration than store-bought versions. If you are buying commercially, look for the label phrase, slow simmered, and check that the broth gels when refrigerated. That gel is the collagen you are looking for. The second food is cucumber, and the skin must stay on. Think of it this way. Proteoglycans cannot assemble themselves without a mineral called silica. Most people have never encountered silica in a nutritional context. But inside your disc matrix, silica acts as the scaffold that locks proteoglycan chains together. Without silica, the chains form, but they do not bind. A chain that does not bind cannot hold water. Clinical studies showed that dietary silicon intake significantly improved connective tissue hydration markers, including markers specific to disc tissue. Published in the Journal of Nutrition in 2007, and this is exactly why the skin matters. Silica in a cucumber is concentrated in the outer skin. A peeled cucumber delivers almost none of it. One full cucumber with skin eaten daily provides a consistent and meaningful silica contribution to disc proteoglycan assembly. If you are over 65, pay attention. Nobody tells you that cucumbers are a spine food. But the silica research is consistent, and silica deficiency in disc tissue accelerates exactly the type of proteoglycan loss that appears on your MRI as disc degeneration. Eat cucumber with skin daily, at any meal. Slice it into your lunch or eat it as an afternoon snack. The form does not matter, the skin does. Now, those two foods are rebuilding the inner core of your disc. But what I am about to show you next addresses a completely different structure. Not the gel, the outer ring. Your male doctor almost certainly never explained that the outer ring and the inner core have entirely different nutritional requirements. Most people are feeding only one of them. That is exactly why the disc continues to degrade even when patients are doing everything their doctor recommends. The third food is sardines. Think of it this way. Your spinal disc has two distinct parts. The inner core is the gel. The outer ring is a layered structure of collagen fibers. Like the rings of a tree trunk, stacked in concentric layers, these fibers resist compression. When they are healthy, they keep the inner gel contained. When they degrade, the gel pushes outward. That is what your doctor calls a herniation. The omega-3 DHA in sardines protects the fibroblast cells of the outer ring. These cells are the only living cells inside your disc capable of producing new collagen. DHA preserves their membrane integrity and reduces the inflammatory signaling that causes them to go dormant, and this is exactly the mechanism most people never hear. Your disc contains living cells. Cells that can still produce collagen if given the right environment. DHA from sardines maintains that environment and reactivates the repair process that chronic inflammation has suppressed. Clinical studies showed that omega-3 supplementation reduced inflammatory signaling in disc fibroblast cells and supported annular collagen integrity. Published in the Journal of Orthopedic Research in 2018, eat sardines 3 times per week. Canned sardines in olive oil are just as effective as fresh. The omega-3 content is preserved through canning, and the olive oil enhances DHA absorption. This is one of the most affordable and concentrated disc protective foods available, and this is exactly the food that most of my patients resist initially. But sardines are the one food on this list that simultaneously addresses the outer ring, provides EPA for systemic inflammation, and delivers vitamin D. Vitamin D is required for the calcium regulation that maintains vertebral bone density surrounding the disc. 3 functions, 1 small can, and the resistance fades quickly once the results begin. The 4th food is tart cherry juice, taken 30 minutes before bed. Think of it this way. Your disc diffusion window opens only when you are lying down, but it does not deliver everything equally. Anti-inflammatory compounds that are circulating during the diffusion window get pulled into disc tissue along with water. Compounds that are not circulating at that moment do not reach the disc at all. The anthocyanins in tart cherry juice reach peak blood concentration approximately 60 to 90 minutes after consumption. Taken 30 minutes before bed, that peak arrives precisely during the earliest stage of non-REM sleep. And this is exactly when disc diffusion is most active. And the most important part, the outer ring of your disc develops small tears under daily compressive load. This is normal. They are repaired during sleep, but only if the anti-inflammatory environment during that window is adequate. Tart cherry anthocyanins reduce the inflammatory cytokines at those micro-tear sites, making each night's repair more complete. Clinical studies showed that tart cherry consumption significantly reduced inflammatory markers in adults over 60 within 4 weeks. Published in Arthritis Research and Therapy in 2020, 240 milliliters of tart cherry juice, 30 minutes before bed, every night. This is a small, low-cost behavioral change that costs less than $2 per day and requires no prescription, no clinic visit, and no waiting room. And this is exactly where I need you to stay with me, because everything I have described so far delivers building materials to your disc. Bone broth provides the mesh components. Cucumber provides the assembly scaffold. Sardines protect the collagen-producing cells. Tart cherry prepares the anti-inflammatory environment, but building materials cannot assemble themselves. They need a signal, and that signal comes from one specific amino acid that your body stops producing in sufficient amounts after the age of 60. Without it, the other four foods are working at partial capacity. The fifth food is what activates the entire system. The fifth food is collagen peptides, specifically type 2 undenatured collagen. Think of it this way. Your disc contains two different types of collagen. Type I makes up the outer ring, type 2 makes up the inner core. These are structurally different proteins assembled by different cellular signals. Most collagen supplements on the market are type 1. They support skin, hair, and tendons. For your spinal disc gel specifically, nucleus pulposus cells respond only to type 2 collagen signals. A type 1 supplement does almost nothing for your disc gel, regardless of the dose. This is the distinction your male doctor has never mentioned. Because type 2 collagen is not a pharmaceutical product, it cannot be prescribed. There is no procedure code for it. But the clinical evidence is precise and it is consistent. Clinical studies showed that type 2 undenatured collagen supplementation improved disc collagen quality markers and reduced disc-related pain scores in adults over 60 within 10 weeks. Published in Nutrients in 2021. And this is exactly why the form matters. The label needs to say type 2 undenatured collagen. Undenatured means the triple helix structure of the protein is preserved intact. When this intact protein reaches the digestive immune cells, it triggers a specific tolerance response. That response signals nucleus pulposus cells to increase production of aggrecan. Aggrecan is the primary water-trapping proteoglycan. More aggrecan means more water retained in the disc. More water means greater disc height. Greater disc height means less nerve root compression. And the most important part, the glycine and collagen peptides also improves deep NREM sleep duration. Longer deep sleep means a longer disc diffusion window. You are not just feeding the disc, you are extending the repair window it operates in. Before I give you the exact protocol, subscribe if this information is useful to you. I publish every single day, and I read every comment. Now let me explain why timing is as important as the foods themselves. Your disc has no blood supply. It cannot receive nutrients the way your muscles do. The only delivery mechanism is osmotic diffusion through the vertebral end plates, and this process only occurs when disc pressure is low. During sitting and standing, disc pressure is high. When you lie down, it drops by approximately 75%. That drop is the diffusion window. It opens when you lie down, it closes when you stand up. And this is exactly why every food on this list must be in your bloodstream before you go to sleep. The bone broth, the collagen peptides, the tart cherry, not at breakfast, not at lunch, before bed. The window is open only while you are horizontal. The nutrients need to be circulating and ready when it opens. And the most important part of this timeline is what most people are never told clearly. Recovery for spinal discs is slower than any other tissue in your body. There is no blood supply accelerating the process. Everything moves by diffusion. Week 1 through 3, proteoglycan precursor levels in the bloodstream begin rising. You will not feel this yet. It is building below the surface. Week 4 through 6, morning stiffness begins to ease. The tightness in your lower back in the first 30 minutes after waking is the clearest early signal that disc hydration is improving. Week 7 through 10, the dull afternoon ache, the compression that builds under gravity throughout the day, begins arriving later or with less intensity, 10 weeks minimum. Not because the protocol is slow, because disc tissue operates on its own biology. And that biology rewards consistency more than intensity. Here is the exact protocol. Mayo Clinic guidelines on spinal disc health consistently emphasize that structural nutritional intervention requires a minimum of 8 to 12 weeks of sustained commitment before outcomes can be meaningfully evaluated. Bone broth at dinner, 3 to 4 times per week. 1 full cucumber with skin daily at any meal. Sardines 3 times per week. Canned and olive oil. 240 milliliters of tart cherry juice taken 30 minutes before bed every night. And 10 grams of type 2 undenatured collagen taken with the tart cherry juice before sleep every night. 5 foods, 3 timing windows, 10 weeks minimum. Write this down. Put it on your refrigerator. The consistency of this protocol across 10 weeks is what produces results. Not intensity, not perfection. Consistency. And here's the one mistake that destroys everything on this list: sleeping on your stomach. In prone position, your lumbar spine is pushed into extension. Disc pressure in this position is 180% higher than lying flat on your back. That is not a small difference. That is the difference between a disc that is diffusing nutrients through an open window and a disc that is being compressed while the window is shut. Every night you sleep face down. The bone broth, the collagen, the tart cherry are circulating and waiting for a window that never opens. If you are a stomach sleeper, place a thin pillow under your lower abdomen and a second pillow under your chest. This reduces lumbar extension and partially restores the disc pressure reduction needed for diffusion. It is not a perfect solution, but it is the difference between partial benefit and no benefit at all. Most people notice a meaningful reduction in morning stiffness within the first 2 weeks of making this single change. If you are over 60 and sleeping face down every night, this positional change may do more for your disc health than any supplement you are currently taking. If this type of evidence-based information is useful to you, subscribe. I publish every single day, and I read every comment. Write your age in the comments below and tell me, were you told your disc degeneration was simply part of aging? Because after today, you know it is a hydration problem, and hydration problems have solutions. My next video is about a muscle deep inside your hip that connects directly to your spine. When it weakens, it creates back pain, hip pain, and groin pain simultaneously. Nobody is scanning for it. It is on your screen right now. Do not wait.